All right, hello everyone. Premier Kenney here with Dr. Deena Hinshaw, Chief Medical Officer, and we are coming at you to answer your questions about Alberta's response to COVID-19. Let me just start out with what I think is some good news. Gosh knows we need some. We seem to have seen a kind of plateauing of our COVID numbers in the past 10 days or so, based on measures that were in place in November. Remember, there's always a lag effect between any policies and their measurable impact. So that is by no means to say that we're out of the woods here yet. We've been experiencing a fall spike in new cases, much like regions all across the Northern Hemisphere as the cold the weather set in and people went indoors. But this spike seemed here really to kick off with Thanksgiving, with social and family gatherings. We think that people also had some Halloween parties against our advice, and that kind of indoor socializing really seems to have created, together with the weather, some momentum that led to very high levels of growth in viral spread. And what was most concerning to us was hospitalizations. At the last week of October, we had only 100 people in hospital with COVID, and by a week ago, we were up to 650. So something like 600% growth in hospitalizations. And if that speed that velocity of growth had continued, we would have been close to starting to run out of hospital space at some point in mid to late January. So we had to take further action to protect our healthcare system and to prevent widespread cancellation of surgeries and other non-COVID related healthcare. That is why Alberta's COVID Cabinet Committee made some very difficult decisions about 10 days ago, which came into effect this past weekend. I truly regret for all of those who are suffering because of those restrictions, but we've always said that we would preserve Alberta's healthcare system and try to protect both lives and livelihoods. That has always been our goal as a province. So the other piece of good news is not only that we seem to have begun a plateauing of new case numbers, and total active cases have come down a bit, the rate of transmission, the positivity rate, all of these things have come down a bit, not enough. But we've also begun our vaccination program, and this week received our first doses. We've started to administer them, and we are on track for vaccinating the 10% of Alberta's population who are most vulnerable, namely the elderly, the frail, people in long-term care, frontline healthcare workers. So Dr. Hinshaw and I are available here for the next hour or so to answer your questions about those or other issues, and I'll go straight away to our first question. And by the way, sometimes people wonder, how do we pick these questions? Because sometimes we'll get as many as 10,000 questions. Well, obviously, we can typically only take about 20 or 25 in an hour, even if we go fast. And we do try to pick a representative sample of questions. If we see one particular issue that has a lot of recurrent questions, our team here picks those out. So there's no effort to edit out tough questions. In fact, I always tell our team, I like the tough questions because we need to address those. First one goes to Jordan Olesko, who says, will personal services be allowed to resume January 16th? Businesses, people, and families are suffering. We need reassurance. So, Jordan, we will be reviewing the restrictions put in place this past weekend in just under a month's time to assess their impact. We'll also have to look at the impact of Christmas, because despite our guidelines, we are expecting that people coming together, even just as families in small family groups at Christmas, may have a negative effect in terms of viral spread, as Thanksgiving did. So we're going to have to look closely at that. But Doctor, would you like to comment more?
Thanks, Premier. I would just echo what you said, which is that I think the best way to help us be able to open more businesses and ease restrictions in early to mid-January is for all of us to follow the restrictions and encourage those around us to do the same, because the more people who follow these measures over the next several weeks, the more quickly we'll be able to bring down our cases the more we'll be able to protect our health system, and the more we'll be able to consider what restrictions can be lifted. What will put those businesses at risk is if people do not follow the restrictions and we continue to see ongoing transmission and spread. And while I know that it's incredibly difficult and that businesses and workers and families are feeling the pinch of these restrictions, and it has always been, as the Premier mentioned, the policy intent to take a balanced approach to minimize the harms of restrictions and the harms of COVID. COVID was starting to win, and we did have to put these measures in place. And the best way to get back to that more balanced approach is for all of us to buckle down and do the best we can over the next 3 to 4 weeks and make sure that we bring that curve down as quickly as possible.
Thank you, Doctor. Next question goes to Aaron Clausen, who says, Mr. Kenney, are you keeping schools open? The kids have suffered enough. Yes, Aaron, we are keeping the schools open. We did return to at-home learning for the grades 7 through 12 a week before the scheduled Christmas break. And frankly, that was because with widespread community transmission, we had more and more teachers who had to go into self-isolation, and we were frankly running out of teachers available for high school classes. But we did keep the K-6 schools open. And I'll remind you, Aaron, that on the advice of Dr. Hinshaw, we did reopen the K-12 schools for in-classroom learning back in August and September, and the government faced a lot of criticism at the time for doing so. I believe it was the right choice because you're absolutely right. Kids at all ages do suffer when they don't have the social experience at school of their being with their peers, when they don't have in-person learning. It sets them behind, and for many children, that will have a lifetime effect that could be, for some of them, even traumatic. So that's why it's so important for us to take reasonable risks in reopening the schools. One thing we've come to learn about COVID is that it does not pose any statistically significant serious risk to the health of children and adolescents. And the younger you are, the less likely you are to transmit it. We were very happy to see very limited numbers or confirmed cases of transmission within schools. We have every intention of reopening the schools for K-12 in classroom instruction on January 11th, and at this point I cannot see anything that would push us off that course. Next question goes to Amy Joyce. Will the restrictions lift once enough people are vaccinated? Doctor?
Thanks. That's exactly where we hope to be able to go. Of course, the amounts of vaccine that are available aren't yet fully determined because the entire world is needing to access COVID-19 vaccine. And so there's significant demand. And we anticipate, I believe you may know, that nationally, I believe there was an announcement that federally they hope to have enough vaccine to offer to all Canadians by early fall. And so that would be fantastic. I think if we did have enough vaccine to make that happen, that is again sort of the end game to be able to protect our population. But in the short term, we only have enough vaccine to be able to offer it to those at the highest risk. So it will take us some time to get there. And I think that it's really important to remember that even though over the next few months we will be able to offer this vaccine for those at the highest risk of death and those who care for them, we will still need to have some measure of precautions in place. And it's become very, very clear that the winter is the most dangerous time for transmission of the virus. So we do need to be ready to have some restrictions, some measures, some precautions in place for several months to come yet.
Thank you. Lloyd Fisher asks, what are you doing to manage the crowds at malls? So Lloyd, as of this past Sunday morning, the malls have been limited to a maximum capacity of 15% of their fire code. What we had done before, before that, was a 25% capacity on retail stores, both small and large, with a 5-person minimum to accommodate very small businesses and make sure that they could continue to function safely. But it seemed that there was some lack of clarity in the regulations. And so the common spaces in malls were not being capped. And so we brought in a very clear guideline effective this past weekend as of Sunday. And I think basically what that means is the malls are having to accommodate that by not allowing store entrances, but people have to come into common entrances so that they can count the number of folks in the malls. Unfortunately, we've also had to suspend sit-down service at food courts and so forth. Malls are often a gathering place for younger people, teenage, high school classes have been out now for a while, and I think what we saw was some young people congregating to be with their friends. Our message is very clear. We're trying to protect a future for these retailers, especially the small and medium-sized ones, by allowing them to stay open, including in the malls. If we were to suspend all of them now, while they have all of the Christmas inventory on hand, many of those businesses would be closed forever. And we would be destroying the livelihoods of many Alberta families that are those small business owners, plus their employees. So with the 15% of fire code capacity limit that we've imposed, we think that's reasonable. It avoids crowds, and we expect the shopping malls to comply with that. Judy Ann says, what is Dr. Hinshaw's view in regards to using ivermectin as a treatment for COVID? Doctor?
There's been a lot of talk about ivermectin lately as it pertains to COVID-19, and there are trials going on in many countries around the world to assess whether or not this could be an effective therapy. It is really important, though, before getting too enthusiastic about different treatments, that we have the results of those trials. And I think everyone remembers early in the pandemic, hydroxychloroquine was a medication that was being celebrated as one that was likely to be effective, and many people wanted to take it as a precaution, as a preventive therapy, or as an early treatment. And when the larger randomized controlled trial results became available, it turned out hydroxychloroquine not only was ineffective, in some trials it seemed to cause harm. And so I know that there's been a lot of press and a lot of excitement about ivermectin, but I would caution against seizing on any kind of therapy that hasn't been adequately assessed, because while, of course, ivermectin is one example. There have been different therapies that have been assessed along the way. It's really critical to make sure we have robust evidence available before we roll out widespread use of different therapies for COVID-19.
Thank you. The next one is for you as well, Doctor. It's from Karen Green. Is there a way to get massage therapists back to work? We have upheld all protocols, and I'm unaware of transmission during massage.
Thanks for the question. We've heard from many people, not just massage therapists, but those whose health conditions are treated or managed by visits to massage therapists. We've heard a lot of examples of people who have making the case that massage therapy is not an optional service, but it should be considered a health service. And so, as requested, we've been looking at some of the options that might be available, but no decisions have been made about massage therapy. I will say that when we were making a determination about where to draw the line with respect to health services and other services, it is difficult. Obviously, massage therapy is just one example. There are other things that do support people in their health, and being able to find that right place to draw the line to achieve the necessary goal of reducing the number of people who come in close contact with each other every day, while at the same time allowing that health service to continue to operate. We chose that line of regulated health professionals. And unfortunately, at this time, as you know, registered massage therapists are not a regulated health profession, and so don't fall within that particular boundary. But as I say, we've certainly heard a lot of feedback, but ultimately we do need to balance the need to reduce our case numbers with the need to consider those needs of Albertans, and that is an ongoing discussion.
So Gordon Svellen asks, I just want to know how to get an isolation hotel. I can't isolate at home. Thank you very much for asking, Gordon. I really appreciate that because we've just announced an expansion of our self-isolation support. If you have tested positive for COVID, or you're exhibiting flu-like symptoms, or you have been the close contact of somebody who's COVID positive, and you therefore need to self-isolate for typically 14 days, we want you to know that there is support if you cannot safely isolate at home. Sometimes you might be at home with others, and it's just that your housing arrangement is just not set up for you to safely self-isolate. Maybe you're having to share a washroom and et cetera, share a kitchen, and it's just not working. So we want to help you get that self-isolation support. We have about 750 hotel rooms that the government of Alberta has rented in Calgary and about 1,300 in Edmonton. We also have hotel rooms available in Peace River, and we are in the process of leasing hotels in Red Deer and Fort McMurray. We may go do this as well in other centers in the province if there is a demand. Please call 811. 811 is the provincial health information line, and let them know that for whatever reason you've had to self-isolate. They can help to verify that those are the reasons for that, and they can then refer you to the hotel self-isolation program. We call it the Community Care Initiative. And I should also let you know that if you live in Greater Calgary or Greater Edmonton, that you may also qualify for some financial assistance if you have to self-isolate in a hotel of $625 after the 2-week period. And that is to help people replace income from time away from work or other expenditures that they've had to incur by leaving family. And so thank you for asking the question. Please call 811. And if I could ask our team also to post a link in the comment section below on how people can access the self-isolation support. The next question goes to Josh Rance, who says, will you guys be taking the vaccine? Well, I certainly will. Yes, 100%. But I will wait my turn in the queue because I am 52 and you can all see I've always got to lose some weight, but I'm generally healthy apart from that. So I suspect that I'll be in the sort of general population group when we get to that more in the late spring or in the summer. And I will put my name in like any other citizen and be called in whenever that turns up. I'm not going to get any special treatment, no queue jumping just because of my job. I know that some of you out there who are very skeptical about vaccines think that people like me should go first to prove that it's safe. The reality is we want to prioritize the people who are most vulnerable to COVID, who are the very elderly and frail, especially those in nursing homes, and frontline healthcare workers. And if you don't think that I'm leading by example, please look to the example of our nurses and doctors and scientists who are the first in the queue. The doctors and nurses are, at least, in intensive care. They are the people stepping up because they want to keep their patients safe. They don't want to unwittingly transmit the virus to their patients who may be elderly and frail. Doctor, what about you?
Absolutely. Of course, at the moment, I am also not in a high priority group. And, you know, it's interesting because we've heard from so many different groups since the vaccine became available, eager to have their occupations listed on the sequencing list that we're going to be rolling out in phase 2 with respect to those occupations, again, whether it's because people are in short supply or perhaps at higher risk of exposure. And so I am looking forward to the opportunity when it is my turn. But knowing the many, many people who are eager to have their names put forward, it is really critical that we are careful about how we allocate and that we're making sure that we're making these decisions based on what we know about risk factors, based on what we know about, again, the risk of exposure. And so I will be very happy to take my place once my category is eligible for the vaccine.
Thanks, Doc. So Calvin Goulet-Jones asks, remember when you said you wouldn't launch a snitch line and then did. Actually, Calvin, the province has not launched a snitch line. I know that that's one of the kind of myths out there. The truth is that Alberta Health Services has always had a complaints line because Alberta Health Services also performs a regulatory function. So they're responsible for partly enforcement of various health statutes, including aspects of the Public Health Act. So that has been a role they've always played long before COVID. There is no new complaints line, no COVID-specific Alberta government COVID line. There is no Alberta so-called COVID snitch line. There is an email address and a web form and a 1-800 number that has been there for years, probably since AHS came into being about a decade ago. If people are aware of infractions of public health orders, they can provide that information. I can't speak. I think some of the municipalities may have set up specific lines, but that's been their decision. It's not, the province has not done that. Stephanie Hallett says, why can't immediate family members quarantine and be together for Christmas? Doctor?
I know that the inability to be together on Christmas is a huge sacrifice. And I know that this time of year is a time when all of us want to be together with the people that we care about, especially with such a difficult year. We want to be able to support each other, and to be able to do that in person is the way that we typically offer and give that kind of support. Unfortunately, this year, even if we did consider, and we did actually consider whether we might go down the road of allowing gatherings if people followed certain protocols in advance, such as quarantining for 14 days before they gathered together. But one of the challenges of setting up any kind of exceptions that relied on that kind of a quarantine process is that the kinds of quarantine that would be required are so strict, and ultimately, I think many people define quarantine differently. So people might think, well, I'll stay home, but my kids might still go to school, or would people still go into work, or would they go buy groceries? There's exposures that people have all the time, and if we said people needed to quarantine, even if we provided specific directions for that, it's not clear whether or not many people would actually be able to follow with that kind of rigor. And I think it also sets us up for the kinds of things we saw at Thanksgiving. Now, we didn't require quarantine at Thanksgiving, but we did have a lot of suggestions for how to have safe Thanksgiving gatherings. And what we saw is when people get together with family, very understandably, the guard is let down, people are spending time together and not necessarily following all the COVID protocols. And we saw a significant and noticeable increase in the 2 weeks following Thanksgiving that, as the Premier mentioned earlier, started us down a path of very significant week-over-week increases, not just in our case numbers, but of course subsequently hospitalizations and ICU visits. And pre-Thanksgiving, we were only seeing around 200 to 300 new cases a day across the province. So imagine what would happen going into Christmas with well over 1,000 new cases every single day, if even a handful of people who, with the best of intentions, tried to do some prep work and then got together, if there's transmission that happens in those family gatherings. And it serves as another accelerating factor, like we saw at Thanksgiving, but with a baseline that is 3 to 4 times as great, we would be causing significant risk to our healthcare system in the new year. So again, while I know that it's incredibly difficult, the way that we protect each other this year is by thinking of other ways to gather, whether that's virtual or again with just the people we live with. And unfortunately, that is the COVID reality for holidays of 2020.
Doctor, maybe I just wanted to pick up a little bit on this because often underscoring those questions is a real understandable anxiety about why the government is telling people who can come into their homes and gather for private social functions. We do a lot of public opinion polling to just assess the level of Albertans' acceptance of public health measures. And our latest round of that research indicates that nearly 80% of Albertans support the most recent series of difficult restrictions that we announced. It came into effect this past week. But the least supported element of those restrictions relates to private social functions at home, which I totally understand. I mean, remember Pierre Trudeau, when he was Prime Minister, said that the state has no place in the bedrooms of the nation. Well, I think most of us would say the state has also no place in the dining rooms and the living rooms of the nation or the province. I completely understand that. It just seems so upside down and counterintuitive that the government would be saying, like as people say on my Facebook all the time, why can hundreds of people go into Costco, but my parents or whatever, my siblings can't come to my living room? First of all, we put a 15% capacity on how many people can go into Costco. Secondly, people do need their groceries, and that's just a absolutely basic necessity. Thirdly, by far the greatest source of transmission has been at-home social functions, as Dr. Hinshaw just said, with respect to Thanksgiving gatherings. I'll give you one very sad example. We had a minister of our cabinet who related the other day. She has close friends who had a family Thanksgiving dinner, and Grandma and Grandpa were there. Grandma has since passed away because she contracted COVID at that Thanksgiving dinner, and Grandpa is barely alive in an ICU unit. Now, nobody wants to do that to their loved ones or family members, but that is what happens at home, is that we all, by nature, we let down our guard. We don't think about external, public health guidelines and measures. We're not wearing masks when we're sitting around our living room or our dining room table, our kitchen table with friends and family. We're not, what we are doing is laughing, embracing people we're close to, and sharing food and drink, spending hours together in close quarters, indoors, and that is absolutely the COVID loves that environment. And so it is painful, and it is a real personal sacrifice. But if we were to have normal Christmas gatherings this year, there is absolutely no doubt that there would be an explosion of cases that would show up in our hospitals, that could stress the capacity of our healthcare system, and would end up with a significant increase in fatalities. So I know it just doesn't seem right, but those are the sad realities that we're coping with. All right, Jeff Hedgie says, what are the chances of kids' teams sports returning in mid-January? If they can participate in phys ed class at school, isn't it reasonable to think they could play sports outside of school? Dr. Hinshaw?
One of the things that we watched, of course, as we were looking at the numbers in the fall, were the kinds of things where we were seeing outbreaks happen. And we did see team sports show up as a place where transmission happened between one person quickly spreading to many. Now, I also know that sports and physical activity is absolutely critical to kids, not just their physical health, but also their mental health. And team sports for kids certainly was a difficult decision to make. As you know, that was one of the things that was impacted in late November, not even just in the latest round of restrictions. And yet, again, we have seen multiple outbreaks take place there. And so I think what we need to do as we're having discussions, and these decisions haven't yet been made, but as I'm considering what recommendations my team and I would be bringing forward in January, is considering, first of all, the numbers. So I'll say the same thing I said earlier about businesses. So the greatest chance we have of opening up activities again, whether that's opening businesses or allowing things like kids' sports to proceed, the greatest chance we have is if we can get our numbers down to a manageable level again. And the more we can lower those numbers, the more quickly we can lower them, the greater the chance that we actually can start to allow some of these activities that are so vital to our communities. But those will depend on the actions that each of us take over the next 3 weeks or so. And those decisions are ones that will be made based on the numbers that we have in mid-January and the risks that are present at that time.
All right, we've got a non-COVID question here, and you guys are free to ask whatever you like. Sherilyn McCallum says, what are you going to do about the insane carbon tax? Well, I think Sherilyn's probably referring to the recent announcement by the federal government that they plan, as I've been predicting for a long time, to raise their carbon tax from $30 a ton to $175, like quadrupling the carbon tax. I was laughed at for predicting this, but I think have now been vindicated with that prediction. This will make life more expensive for everyone, for living normal lives, for heating their homes, for filling up their gas tanks. It'll be especially punishing for farmers and rural people who expend more energy, for trade-exposed industries where we're not seeing taxes like this imposed by our competitors. So it is, I think, extremely bad economic news for Alberta. In fact, our initial projection is that it could cost us 90,000 jobs in this province alone and 3% of our economy. And that is why we filed our constitutional challenge against the federal carbon tax last year. We won at the Alberta Appeal Courts in a 4-1 vote, in which they said that the federal carbon tax was a, quote, constitutional Trojan horse. And that is now on appeal to the Supreme Court of Canada. Oral arguments were heard in September, and we understand that the judgment will be issued by the Federal Supreme Court of Canada in March of next year, and we will wait to see that judgment and then determine what our next actions are depending on the decision. Leah Love says, what are the ingredients of the vaccine, and does it change your DNA? Are you covered if you get vaccine injuries? I think that one's for you, Dr. Hinshaw.
So the vaccines that, the one vaccine, the Pfizer vaccine that's currently approved, and the vaccine, the Moderna vaccine that is working its way through the approvals process right now, those two vaccines are made up of a small fragment of the virus's genetic material. And as you likely know, when the virus invades someone's body, what it does is the virus enters the cell and then hijacks that cell to be able to make copies of itself. And so this vaccine technology uses our body's ability to make copies of proteins without actually being infectious. So the small genetic fragment does not change our body's genetic material. What it does is it shows our body essentially the fragment of that particular genetic material of the virus, and then our body can make the proteins that mimic the spike proteins on the cell, so that our bodies can recognize if we do get exposed to the virus at a point in the future, and we already have antibodies that are ready to neutralize that virus should it appear. So essentially what it does is it's using the same mechanism in a safe way that would happen if the virus invaded the body, but it's doing it in a way that doesn't cause infection and doesn't cause the possibility that someone can get significantly ill from the virus itself. With respect to vaccine compensation, of course, that is a topic that is being looked at, and I'm not 100% sure where that process is at right now, but I do understand that more information is coming soon with respect to planning on that front.
I think I'm not sure if you mentioned this, but I think it's worthwhile pointing out that both the Pfizer vaccine, which has received federal Health Canada approval that we've begun administering here, went through extensive trials. Admittedly, they were faster than normal trials, but those trials involve thousands of vaccines that are administered to people in the control group, plus a similarly sized placebo group. And the conclusion in the peer-reviewed scientific studies was that there were no statistically significant negative side effects from those who received the vaccine. And please understand that the companies who validate that they are taking on enormous liability when they do so. I mean, if a large pharmaceutical company is fabricating that information or not isn't doing their research correctly, then they stand for enormous, potentially multi-billion-dollar liabilities if they're wrong about that evidence. So, similarly, the Moderna vaccine that we'll be receiving next week, and I'm not sure, Doctor, if it's yet received Health Canada approval, but they had as well. They found 94% effectiveness in terms of the effectively elimination of serious symptoms for those who took the vaccine with no measurable significant side effects. Is that correct, Doctor?
Yeah, so certainly there were side effects like we see when people get a vaccine. The purpose of the vaccine is to give a heads up to the immune system. And as the immune system gears up to make those antibodies, some of the things that people experience are because of how our immune system works. So people may get a fever, they may feel a bit achy, some pain at the site that the vaccine goes in. All of those things are very common, again, because that's exactly how our body works when it's gearing up to defend itself against any kind of foreign particle. But you're right in terms of serious side effects. Those were not seen, and the safety profiles of both Moderna and Pfizer were very good. And I do just want to comment on the trials, because any vaccine that is licensed in Canada does have to go through a very rigorous process with multiple stages of trials, including the phase 3 trials, which are the ones with tens of thousands of participants that you're referencing. And I think that it's important to note when some people hear that a trial was proceeded more quickly than perhaps another vaccine trial, they may think it was rushed and corners were cut. But what I want to make clear is that the end point of a vaccine trial is to determine how well it works to protect against a particular bacteria or virus. And when that particular virus or bacteria, as in the case of COVID, is circulating widely, it doesn't take as long to reach those endpoints, because there's many more infections in the community. And so when you're testing the vaccine in communities that have widespread transmission, you actually can see how well it works much more quickly. Whereas if you're testing a vaccine in a context where there isn't as much of that particular virus or bacteria in the community, it can take longer before you can actually see how well it protects against that particular germ. So again, it's really important to understand some of the reasons why we have been able to get good information more quickly. Part of that is because COVID-19 is so new, we don't have pre-existing immunity, and in places where it was spreading widely, we were able to then assess, or the companies were able to assess its effectiveness more quickly than might have been the case with a less common germ.
Interesting. All right, Jeff Saunders asks, why can't gyms be open at 15% capacity? Keeping our health and exercise up will only help fight against the virus, also not to mention the mental health aspect of it. This is a very fair question, Jeff. Dr. Hinshaw?
Absolutely, and similar to sports, I would say that these decisions, none of them are taken lightly. And when we were looking at the kinds of locations and activities to be closed versus where the percentage limitations would apply, part of what we were looking at was the evidence, not just from Alberta, but from other jurisdictions about the locations where the risk of transmission is highest. And of course, as you know, the whole point of being in a gym is to exercise, as you say. And we know that vigorous exercise is one of the risk factors for generating more infectious particles. And gyms have done an amazing job, I will say, at putting mitigating factors in place. And I commend those who operate those fitness studios, whether it's a more traditional type gym or those who do group classes, because there has been a lot of work. But the challenge is the things that worked in the summer and early fall, the measures that we had in place that kept us at a fairly stable new case rate for several months, aren't as effective in the winter just because of how this virus transmits. It seems that it might be able to survive for longer in colder, drier temperatures or climates. And so, unfortunately, we do see that gyms are a place that has higher risk of transmission when compared, for example, to a retail location. And they are places that, unfortunately, even with a 15% capacity limit, still carry that risk. And of course, as we're looking at our numbers, again, the more quickly we're able to bring our numbers down, the more we'll be able to consider what locations may be able to open. As you say, potentially we will have to have some kind of a restriction on how many people can use it. But for now, what we all need to do is limit the number of times that we're in contact with others or in contact with surfaces that others have recently touched. And I know that that impacts, again, not just those owners of those businesses, but those who use the businesses as well. And I regret that impact. And at the same time, we must make sure that we are protecting our acute care and preventing the kinds of serious outcomes. As you likely know, today I had to announce 30 deaths that we had been reported to us just over the past 24 hours alone. And we have no easy choices with this pandemic. It is the reality of what, not just in Alberta, we're facing, but around the world.
And our condolences, of course, go out to the loved ones of all of those 30 individuals today, and over 700 who've lost their lives over the past 10 months from this disease. Amanda Burton asks, can you explain how it's acceptable to let people from all over the world come to Edmonton to play hockey, but it isn't allowed to have your own family members over for Christmas? Thank you, Amanda. And that's a good way of putting the question I kind of was framing the other a little bit earlier about Costco versus Christmas at home. The answer is this. There were very detailed and rigorous protocols and public health measures put in place to accommodate the NHL bubble. Everybody traveling here had to be tested before they got on a plane. They were tested once they arrived here. The NHL paid for frequent testing. I think in some cases it was almost daily testing of those individuals. No one was allowed to leave the bubble. No one, for a space of whatever it was, like 10 weeks, to go into the general population. The players were all in their hotels, and every single step of what people were doing was closely regulated and supervised, and we ended up with not a single known case of transmission or COVID-19 illness in that bubble, so that worked. But if a couple of those NHL players were to come over to your house and sit down next to members of an extended family for Christmas or Thanksgiving, and there's no masks being worn, no one's being tested coming or going, there is people spending several hours right close to each other, sharing food and drink, doing all of those things that are most likely to cause transmission. I'll come back to the Costco or Walmart example. Yes, there might be now with a 15% restriction, 250, 300 people in an enormous box store, but they're all wearing masks. They've all hopefully followed the rules and sanitized their hands on the way in. They, in many cases, are being checked for symptoms or asked about symptoms. That was certainly the case with the NHL every single day. They're at most passing somebody in the aisle for a second or two. Compare that to sitting around a table with 6 or 10 or 15 of your close family members for hours, sharing food and drink, laughing, hugging family members. That level of intimacy is what makes it so much more likely for the virus to be spread. Doctor, would you like to correct me if I'm wrong about that or comment on that?
That's correct. And I would just comment that, of course, the World Junior Hockey Championship is being held in Alberta this year. And so in addition to the example that you provided with the NHL, I have written an exemption for the World Junior Hockey Championship to be able to continue as long as they follow those same rigorous protocols that were very effective with the NHL. And I will just say that it is a judgment call with respect to having to cancel that event versus allowing it to go ahead with safety protocols. I am 100% confident that that event does not constitute a risk to public health because the protocols are rigorous and have been tested in the NHL playoffs. So that event, again, is not a risk to public health. What I think that I've heard some people concerned about is the element of fairness, that people who live in Alberta can't play hockey right now, whether they be children or adults. And yet we are creating this exemption to allow hockey players from other countries to come in and compete in the World Junior Championship. And I acknowledge that that's a judgment call and it's a hard choice, and that many people are being asked to sacrifice their ability to play team sports right now. I will just say that I made that decision again based on the fact that I was confident that public health would be protected with those protocols. And I know that the World Junior Hockey Championships for many is a source of joy, and that it could be done safely without that risk to the community. And so I did make that decision to provide that exemption, and again recognize that for some people they would disagree with that judgment call, but that is the call that I made based on the fact that it does not provide a risk to the community.
Thank you. So Bruce Yetman asks, what are you going to do to get the CPP from Ottawa before it's all gone? Okay, another non-COVID question. Thank you, Bruce. I think implicit in Bruce's question is the federal government's running huge, unprecedented deficits and debt, and that may, I think his question suggests, imperil the future of CPP. So the answer, Bruce, is that the government of Alberta, based on the recommendation of the Fair Deal panel, is doing a deep technical study of the potential cost, benefits, and structure of an Alberta pension plan. We're looking at the successful model of the Quebec pension plan, which has operated separate from the CPP now for 60-some years. The strongest argument for Alberta doing this is that we have by far the youngest population in Canada. So effectively, our CPP premiums constitute about a $3 billion subsidy to Canada Pension Plan beneficiaries in other parts of the country. And the idea in principle is that we could repatriate that money to improve benefits for Alberta seniors and or reduce taxes on Alberta workers and job creators to help our economy. But as you could understand, it's a hugely complicated issue. And before we make a recommendation to Albertans one way or another, we need to do a much deeper technical study, which is being undertaken right now by the Department of Treasury, Board and Finance. Sam Ritter asks, if you have allergies, do you recommend that they take the vaccine? That's for you, Dr. Hinshaw.
In the UK, as you likely know, there have been 2 reported instances of allergic reactions, severe allergic reactions to the vaccine. And our National Advisory Committee on Immunization has looked at that evidence, those 2 reports, and has determined that just like any vaccine, that we would make sure that people knew what the ingredients were, and that if they were allergic to any of the ingredients, then of course we would not recommend that they take the vaccine. One of the ones that they had specifically flagged in the latest update that they did to their guidance is something called polyethylene glycol, which is something that's often used as a laxative to treat constipation. And so if someone has an allergy, for example, to that component, then of course they should not take the vaccine, as it could potentially cause that allergic reaction. Those kinds of allergies were not seen in the more than 40,000 people who participated in the trial to test the vaccine's effectiveness. And so, of course, we continue to monitor very closely for any kinds of signals. And that is, of course, why in the UK, when they had these 2 instances, they did a very careful examination, and they initially changed their assessment in the UK to indicate that anyone who had a very serious allergy, so carried an EpiPen, had an anaphylactic allergy to anything, would not receive the vaccine. But again, after very careful review and consideration of all of the evidence, our National Advisory Committee felt that it was most appropriate to limit that restriction to those who have a severe allergy to the components that are actually in the vaccine. And that does align with the recommendations, of course, with any vaccine. We never recommend that somebody who has an allergy to those components receive the vaccine.
All right, next question goes to Mr. Larry Grant. these internment camps planned to be built, are they for people who refused the vaccine? Well, Larry, I can tell you Alberta's not building any internment camps. I know there were some stories a couple months back about the federal government having done a RFP for quarantine centers. And my understanding is that really dates back to the spring. You may recall when we had a bunch of Canadian citizens stranded, they were in China, in the Hubei province where Wuhan is located. They were coming back, and quite sensibly, the federal government wanted to quarantine those people. To be blunt, Larry, I wish that they had done so more broadly for people coming back from hotspots then, including northern Italy and Iran. I think that would have maybe helped to prevent travelers from spreading the virus here unwittingly. In any event, you may recall that back then in March or April, the federal government took, I think it was 200-300 Canadians from Hubei, Wuhan, and put them into CFB Trenton, an Air Force base, I think, for the 2-week quarantine period. So I think they were looking early on at expanding that for returning travelers. But I'm not, an internment camp is not an accurate description for any of that. And in terms of what we're doing as a province, Larry, we've leased about 1,500, 1,700 hotel rooms that people can voluntarily choose to move into for a couple of weeks. They're not locked in their rooms. There's no armed guards. There's no fences around. These are hotels. But if they need to self-isolate so they don't infect the people they love and live with, but they can't safely do so at home, then we're giving them an option. It's their choice, not the government's choice. There's no internment aspect of it whatsoever. And secondly, Larry, there will be no mandatory or coerced administration of the COVID-19 vaccines in Alberta, period, full stop. So I wish you folks who are opposed to vaccines in general, and the COVID-19 vaccine in particular, would take yes for an answer. There will be no mandatory, coercive, compelled vaccination or inoculation. In fact, to make that point absolutely clear, when the Alberta legislature resumes for its spring 2021 sitting in April, one of the first items of business will be amendments to the Public Health Act, in which we will be removing the power of mandatory inoculation that has been there since 1910. We don't know that it's ever been used, but in order to remove the anxiety that some folks have about potential forced vaccines, we are going to remove that legal power. And the Prime Minister, with whom I disagree on many, if not most issues, himself has said the federal government agrees with that. They have no intention of mandatory vaccinations. So, folks, I know that there are some of you out there who, for whatever reasons, are just dogmatically opposed to vaccines. I think that's unfortunate. I wish you would take a close look at this to help keep everyone safe, but it's your choice at the end of the day. No mandatory vaccines, no internment camps. And how about we turn the volume on that stuff down just a notch? Because, quite frankly, I think since the beginning of COVID, we've seen a certain degree of kind of promoting fear on both extremes of the debate. We don't need that. We need to come together as a community, support each other, and exaggerating fears like that, I think, are really counterproductive. All right, Jace Miracle says, Mr. Kenney, what's your position on Justin Trudeau's OIC gun ban? That's Order in Council gun ban. What are you doing and willing to do to stand up to Trudeau for Albertans' firearms rights? Thanks, Jace. The answer is that we, as a province, will be appointing our own chief firearms officer to be responsible for the administration of the federal firearms legislation in this province. MLA Michaela Glasgow from Brooks Medicine Hat is leading province-wide consultations on that and related questions to get input from the community of law-abiding firearms owners on how we can more effectively fight back against this federal overreach. I would point out that law-abiding firearms owners are not the problem. Criminal gangs who import illegal firearms from the United States are the problem, and that's where the focus should be. We are also considering potentially supporting one of the many legal challenges of the Order in Council to which you referred, Jace. Kevin Rittinger asks, how many of the questions are you answering have been pre-staged for this broadcast? Well, I'm going to ask my staff, have any been pre-staged? Are these all questions that people have posted? So Kevin, you can, that's been confirmed for me that none of these have been pre-staged. So you can go through every question that we've selected and find that they've been written into the comment section below by a real person with a real Facebook account. None of this is pre-staged. And I think the proof of that is that we ask some pretty tough questions that are critical of the government. Happy to do that. Brian Hebson says, what do you see outdoor events looking like next summer in Alberta? Example, fairs, pro sports festivals, etc. Do you have a model that outlines what COVID needs to look like for events to take place? That's a really, really good question, Brian. We're just starting to get our heads around that. I've said to Dr. Hinshaw and our team that I believe that by the end of February, we need to give a very clear signal about what summer events might look like. I am hopeful that with the plateau in cases we're seeing now, plus the expected decline in numbers coming from our most recent restrictions, and the growing positive effect of the vaccination program, that we will be in a position by the summer significantly to reduce, but not completely eliminate, public health measures. What exactly the implications are for that, for summer festivals, for the Calgary Stampede, for rodeos, etc., we don't yet know. But I'll just go out on a limb here and say that for outdoor events, I think we have more flexibility than we do for smaller indoor events for obvious reasons. But we'll be turning our attention to that in the month of February. Dr. Hinshaw, would you like to add anything more to that?
No, I think you're right. First of all, as you said, we do need to give a little bit, not a little bit, we need to give certainty or ability to plan well in advance. We can't make a decision on this in June and expect people to be able to actually go forward. So that's very clear. I think we know at the moment that this virus has a very clear seasonal pattern of spreading much more easily in the winter than in the summer. We also know that the summer doesn't make it go away entirely. So I think, Premier, your comments are exactly what I would say, which is that there's lots of things that we anticipate will be in place by next summer that will be protective. And at the same time, it's likely we will have to have some kinds of measures, protective measures, but hopefully less than we needed to have last summer, because of course we're going to have a lot more protections in place and more vaccine available, for example, than we had last summer. So I do think there's hope, and we'll have to see as this vaccine campaign is rolling out, and as we're learning more from other countries that have their summer season right now, what we can do next summer. But I do think it will be better than last summer.
All right, next one goes to Stephen Dennis Stowe. I'm a Canadian Forces Afghan combat vet. How far does this go? What's the level of freedom you're willing to take from the citizens to keep them safe? Is there a line in the sand that you will not cross, that you won't cross? First of all, Stephen, thank you very much for your service to our country and our uniform in Afghanistan. And thank you, secondly, for raising a very important question about our fundamental freedoms. I've been, I think, perhaps the only government leader in Canada publicly to express my deep reservations about many of these restrictions because of the impairment of constitutionally protected rights and freedoms that some of them represent. And what I've said is that, as our Constitution makes clear, governments can abridge fundamental rights and freedoms if those abridgments are reasonably justifiable in a free and democratic society. What our courts have said is those abridgments can only be done, they can only be justified if there is a clear and compelling public policy reason, which I would say in this case is to avoid the complete overwhelming of our healthcare system and mass deaths. Secondly, if the abridgment or the limitation is proportionate to the, so in other words, if the policy goal is proportionate to the liberty that has been abridged. And thirdly, if the abridgment is limited. And that is the framework that, and Dr. Hinshaw will tell you, I mean, I'm often kind of get up on my pulpit about this when we're discussing these issues within the cabinet, because I am concerned that in this COVID year, there has been a tendency by governments to almost rush to abridgments of rights and freedoms without thinking this through very carefully and making those abridgments only a last and limited rather than a first and maximum resort. So, Stephen, that's my kind of a theoretical answer. In a practical way, while there have been abridgments of people's ability to earn a livelihood, which I profoundly regret, for right now, I would estimate under 10% of Alberta businesses. Most rights and freedoms have continued unabridged. You're able to ask a question like that. We're not abridging your freedom of expression. People are going out to protests. I don't like it if they're doing that in a way that is not careful, but they are exercising those rights, freedom of association. Freedom of religion. We are the only province, I think, that has allowed churches and places of worship to stay open throughout. Yes, with limitations right now in terms of numbers and how people worship, in terms of physical distancing, masks. But fundamentally, we've tried to strike that balance. So all I can tell you is there is no perfect formula for the right balance. But I truly believe that the vast majority of Albertans would not accept it if we allowed the virus to run free without any effort to control it. If we went from, right now, 750 people in hospital with COVID, with exponential growth, if we went from that to 1,500 to 3,000, we would be past our maximum capacity in the healthcare system. And then we would be, as the voices of panic have suggested, at that point we would be setting up tent hospitals in the middle of the winter in Alberta. Our doctors would have to be triaging patients, deciding who not to give care to. The average age of COVID hospitalization in Alberta is 60. Just think about that for a second. Yes, the average death is 82, people with multiple comorbidities, but the average age of hospitalization is 60. There's a lot of otherwise healthy people in the prime of their life who end up in COVID getting care in hospital. How many of our grandparents would we say in that catastrophic scenario we're no longer able to provide hospital care to in Canada, in Alberta? That is a price that I think, well, very few people are willing to pay, a risk that very few of us are willing to take. So what we've tried to do, Stephen, I admit imperfectly, is to find that balance which respects and allows the enjoyment and exercise of fundamental rights and freedoms with minimal impairment while preventing that kind of out-of-control scenario. And I'm sorry for those of you who think we haven't done this correctly, but please understand, my challenge to you is, what would your advice be to us as decision makers? To take off all restrictions in the middle of the winter when we were facing exponential growth just a couple of weeks ago? How many lives are we prepared to see lost as a consequence of that? I agree, by the way, to be clear, I've said from the beginning that this is not about eliminating risk, that we're not chasing zero cases like some jurisdictions have. I think the price is too high to pay for that. You know, just like the government doesn't eliminate the risk of road accidents by barring people from driving cars. We don't eliminate the risk of heart disease by barring people from eating bad food or whatever. But so we assume in a free society that there's a certain amount of risk, but in a pandemic like this, the risk could be in the order of thousands of lives for our most vulnerable citizens, our seniors who built this province. And not only them, but the thousands of people whose surgeries would be canceled. You know, I had a constituent whose wife had her scheduled surgery postponed, and he wrote me a furious email. Why are you allowing this to happen? Well, that happened because more and more COVID patients in the hospital have displaced regular surgeries. He and his family are right to be upset. Those are the real world consequences, not theoretical or abstract consequences of allowing the virus to grow to a point where it really jeopardizes our healthcare system. I'm sorry I went on a bit of a rant there, but those are the kind of considerations that we're trying to balance. We're past a 1 hour mark, and I think, well, I'll speak for, I don't know about me, but I suspect Dr. Hinshaw has been working already a 16-hour day. So why don't we just take two more questions? BG Sonoma says, will the government allow businesses to demand people to be vaccinated to use their services like concerts, airlines, schools, etc.? So BG Sonoma, the answer is I don't see how they could do that, because we have a Privacy Act which does not allow anybody to ask you about your health status unless it's for a very specific, narrow purpose, like, for example, applying for insurance. And we have no intention of providing or of cooperating with those kinds of demands. I keep reading about this idea of a vaccine passport. Well, people are not going to be getting a vaccine passport from Alberta. We're not going to be issuing proof of vaccination. That is a private medical decision that you make, and it stays private as far as we're concerned. And as far as I'm concerned, unless it's for a very legitimate purpose, like applying for life insurance or something, a company has no business asking about your health status. Aurora Allure says, how are you going to help with the inevitable increase for mental health support? A very important question, Aurora. And we believe there's a lot of data points that add up to a significant mental health challenge here. We had one before COVID. So the answer is, before COVID, Alberta's government had surged $150 million in additional support for mental health and addiction services. And at the beginning of COVID in the spring, we added another $53 million in support. Everything from the Kids Helpline for kids coping with mental health challenges to expanded drug treatment supports and much more. We've appointed for the first time in our history, a Minister for Mental Health and Addictions who's leading those efforts. And if we need to provide even more support, we certainly will do so. Let me just give you a little important bit of information. There is, I read online, a widespread view that we've had a huge increase in suicides in Alberta related to COVID restrictions. We are very concerned about suicide as the worst manifestation of mental health challenges. We've been following the numbers very closely, and I can report to you, this has been released publicly, that for the first 6 months of this year, our suicide rate was 19% below the average for the past 5 years. We've not yet published the data since for the months since July, because we go back and we try to be very careful about ensuring the accuracy of that data. But I can just tell you this, that the numbers have stayed stable, thank goodness. We have not seen an increase in the suicide rate in Alberta this year. So far it's below the average for recent years. But we do believe, the mental health experts at least believe, that there may be a delayed reaction from the stress that people are under, and we'll be keeping a very close eye on that. I got one more question. Why does Klaus Schwab say life will never go back to normal and that these lockdowns will be a part of our lives now? Oh, that's from Rachel Keeper. So for those of you who don't know, Mr. Schwab, Klaus Schwab, is the president of the World Economic Forum, also known as the Davos Summit, the recent author of a book called The Great Reset. I've commented on this before. He sent me a copy. I have not read that. But I probably should read it. I've said before I'm not going to bother, but I should probably inform myself. Apparently, I hope this is not a apocryphal quotation, but I've read in commentary articles that Mr. Schwab says that within a decade or something, he foresees the end of private property. So I got to go back and verify the quotes myself. But as I've said before, a lot of this just sounds like regurgitated socialism and ideas that have failed catastrophically throughout modern history. And that's, you know what? We live in democratic societies. People are free to put forward those ideas, and if they can get electoral support for them, that's how democracy works. But the idea of exploiting a crisis like this to advance a particular political agenda like that, I think is just awful. And I just thank you for the question. All right, Doctor, we seem to have run out of questions for you at least, and we're going over time, so I will wrap this up. Thank you very much, Doctor, for joining us. I know you work so hard. And by the way, I'm just going to say, Dr. Hinshaw, look, I get a lot of criticism, but that's fine. I signed up for this. I'm elected and accountable to 4.5 million Albertans. Dr. Hinshaw was hired based on her expertise and experience as a member of our permanent professional public service. As a senior, she's an assistant deputy minister at the Department of Health. She is a public health expert who has served Albertans in that capacity. She grew up in Sylvan Lake County in I think, third-generation Alberta farm family. Is that right? Fourth generation? So Dr. Hinshaw is an Albertan through.
My great-grandparents homesteaded, yep.
There you go. Dr. Hinshaw is an Albertan through and through. I'm a relative newcomer. Like a lot of Albertans, I grew up in Saskatchewan and came over here. So I just wanted to say, I just appreciate our Chief Medical Officer. Folks, you may disagree with various decisions that have been taken. I'll share with you a kind of a joke. Stephen Harper, when I was in his cabinet, used to say, people would approach him at hockey games and say, you know, Mr. Harper, I may not agree with everything you do, but I appreciate you. And he would say, I don't agree with everything I do either. By which he meant that in government, sometimes you only have bad choices, and you don't always get the optimal choices. So that's how I think both Deena and I have felt through, as anybody in a position of responsibility through this COVID period, that often we've only had bad choices or not good choices. Yet we've tried to make those choices with balance and in the public interest. And I just want to appreciate Dr. Hinshaw, a fourth-generation Albertan who truly has a heart and a spirit for public service. And while I signed up for the public criticism, she didn't. Normally, public servants are outside of that range of public criticism. She has been receiving that, and I regret that. But I just want to say thank you, Deena, for your amazing work this year, the sacrifices that you have made, the wisdom that you have brought to all of this as our principal advisor on public health. We truly appreciate it. I wish you and your family a joyful Christmas. And by the way, tomorrow is the last day of Hanukkah. So to our Jewish friends, let me say for the last time in 2020, Hag Hanukkah Sameach. And to everybody who will be celebrating in one way or another, Merry Christmas. And I can say that we are all looking forward to closing the book on 2020 and starting anew in a more hopeful year. So thank you, Deena. Thank you all.
Thank you.